One patient encounter I had 2 years ago captures the potential for strain-based treatment to transform the care of patients with acute heart failure. The patient was a 68-year-old female who was brought into the resuscitation bay by EMS with hypoxic respiratory failure. Her blood pressure was through the roof, and her pulse ox was 80% when EMS arrived at her house. Her lungs were filled with fluid, and she had innumerable B lines on her lung ultrasound. She was started on BiPAP and treated with bolus nitroglycerin. The first point-of-care echo, which you can see here, shows profoundly reduced LV longitudinal strain with a global longitudinal strain of negative 6.3%. And looking at the bullseye map, it is evident that there is a lot of mechanical dyssynchrony. And many of the patient's LV segments do not actually shorten during systole, as evidenced by the patches of blue throughout. Just 2 hours later, the patient's respiratory distress had improved and her blood pressure was now 150. We repeated her echo, and the changes in just 2 hours are dramatic. Overall, global longitudinal strain has improved nearly 100% to negative 11.2 over just 2 hours. All of the dyskinesis and much of the mechanical dyssynchrony is now gone. Here at the Wayne State University Department of Emergency Medicine in Detroit, we are pioneers in the application of novel point-of-care echo technology to patients with acute heart failure. Nobody else in the world has published in this area except for our group. I have compiled a team that consists of experts in their respective fields, including Dr. Philip Levy, a world-renowned cardiovascular researcher, Dr. Robert Ehrman, a national leader in the study of diastolic dysfunction in the ED, and Laura Gowland, a certified cardiac sonographer who is a full-time employee of our clinical research division. This team is perfectly suited to build on promising preliminary data by studying the effects of non-invasive positive pressure ventilation on the left ventricle in patients with acute heart failure. In addition to our expertise and experience, the resources we possess are enviable, including 4 GE VividQ portable ultrasound systems and our very own EchoPack workstation housed in the state-of-the-art Integrative Biosciences Center. We are Wayne State Emergency Medicine in Detroit, and this is what we do.